Fantastic. This is the Town of Fairfield Board of Health um, monthly meeting, March 8th, 2021. We'll call the meeting to order at 7:33. And I see here board members, Dr. Hotchkiss is there. Mary Frances, I think you said you were there. Sally Connolly, are you there?
I am, and I had
There
a
you are.
tonsillectomy. I had a tonsillectomy last week, so I kind of can't talk that great.
Ah,
Oh boy.
lucky you.
I know.
And Carolyn Durgee, you there?
Yes, I am.
Fantastic. Dr. Morose, are you there? I do not believe so.
No,
And,
no, she's not.
okay. And Ms. Vitale, are you there? No, I do not believe so. And then from the Department of Health, we have Ms. Flynn, Mr. Cleary, and Ms. Mitchell have all joined us today. So fantastic. Why don't we go ahead and if hopefully everyone's had a chance to review the minutes from the February 22nd meeting. If so, if I can get a motion to approve the meeting minutes.
Motion to approve.
Thank you. Can I get a second, please? Anyone?
A second.
Thank you. Mary Frances?
Yep.
All right. Do I have any objections? Hearing none, the motion is passed.
All in favor.
Oh, all in favor? Aye, thank you.
Aye.
Aye.
Any opposed? All right, thank you. The motion carries. Moving on to reports, Director of Health.
Sure. So yeah, I'll go through this pretty quick. And we've had to date, so pretty much the health department is the predominant task for the past, since mid-December has been vaccination, as it is for most local health departments. And so that continues to be our predominant task, followed shortly by contact tracing. So we've had to date 26 clinics, different clinics. We've done all 4 types of clinics in VAMS. We have vaccinated 11,929 individuals to date. We've got another 4,052 appointments on the books for the next 4 weeks. The state announced that they went just over 1 million vaccinations this week, and the town of Fairfield by itself has done 1% of that with our current, just almost 12,000 doses. This past Monday, March 1st, the first day that they were eligible, we vaccinated 1,005 education and child care staff on one day. In addition to that, in our remaining clinics, we had reserved second dose slots, as required by the state. We have to make sure we reserve slots for those who are vaccinated with us first doses for second doses. And we had that reserve in place for a couple of weeks, and when we were able to time it and release those spots. But prior to that, we were able to give education and childcare staff a heads up that we were about to do that. So in addition to the general population that we're doing, at those clinics, we were able to free up an additional 800 spots for education and childcare by releasing those slots, which filled up very quickly, indicative that we got the message and we're able to sign up quickly. So we think we've done about, we've done 1,005. We'll have another 800 or so coming through this month. And what I can share is some interesting, I'm going to share my computer here. I want to get Chrome. And I will show you just some interesting results that we have. How do you do this now? it won't let me, let's see. No. Let me see if I can pull this bar down. I know you can see this, but I can't get at the bars underneath. Oh, there it is.
Sans, can you do the scroll on the right-hand side there?
Oh, I don't know what I've done. Somehow I've hit, I'm going to stop sharing. Somehow I've hit like a pen or something like that. Let me try it one more time with your patience. There it is. Not that page. Well, for some reason it is not letting me do what I want to do, which is share the results of a survey that we did. But I can summarize it real quick. So we surveyed on Friday. We sent out a survey to all education and child care staff. We got 1,100 responses over the weekend. And some of the interesting data that it showed was that about 23% of education and child care staff are already fully vaccinated, which was kind of intriguing to us. 49% of the individuals responding indicated they have their first dose and have scheduled their second dose. And only very small percentages of people unable to secure a first dose appointment yet. I mean, it was like 60 individuals out of that. And with most people either having a first dose, most people indicating they had a first dose either in March or in April. So most people are signed up for their first dose in terms of education and childcare staff. And a fair portion of them are already fully vaccinated. So we will continue to basically wait for our allotment for next week to determine what we can do in terms of providing additional clinics for educators. So the state has requested that we focus this month on education and childcare, trying to get every one of them their first dose. And so that's what we'll try to keep doing that. We do have our general clinics that were already scheduled, prior to, but we will continue with those and then try to add a few educator clinics. This week, our clinic is, very tight on vaccine. So we're over the weekend, I was working, we're arranging borrowing doses from other health departments and local health centers, but state indicated over the weekend that they were going to send us enough to cover it. So we should be okay for this week without having to cancel any appointments. The challenge that we're facing this week is for our first dose slots, we have a mix of Moderna and Johnson & Johnson. And so today we sent out a survey because there's some hesitancy regarding Johnson & Johnson that to see if we have more people that would refuse to take the Johnson & Johnson if it was offered to them than we have supply of Moderna. So we'll figure that out as we go forward. We asked everybody to reply by tomorrow at noon. So, but the worst case scenario, we'll have to, for those who don't want it, we may have to cancel a few appointments for them and wait until they can get the type that they prefer. Right now in Connecticut, about 72.4% of the population greater than 75 have have been vaccinated with 1 dose. And of the total population, it's 18% of the total population in Connecticut has been vaccinated. For Fairfield, we're at that same number. About 18% of the population has been vaccinated with at least 1 dose. The county is currently at around 15%. So we continue to, be predominantly about vaccination at the state level. Just some additional numbers about where we are. I shared that we were at 1.1 million doses administered. About 700,000 of that is first doses, and about 400,000 second doses. Right now, 65 to 74%, 65 to 74 year olds, about 59% of them have been vaccinated, at least 1 dose, and 55 to 64, we're at about 74%. So, and the issue is that the 55 to 64 came at the same time as the teachers. The state has asked us to focus on education and childcare staff, and so they're kind of finding it harder to get appointments, but many of them are finding. I thought I would also share some CDC information in terms of data about where we are. So CDC indicated today that they are continuing to see declines in most of the major variables across the country as a whole. They are seeing some individual variables, either the decrease is the rate of decrease is starting to slow, and on a few variables they're seeing some plateau, but they're not sure if this is just a temporary thing, or if it'll continue to decline as we go forward. So from a data perspective, we're seeing the same kinds of things in Connecticut. In general, everything is going in the right direction. Things are declining. On a couple variables, we've seen things that decline plateau somewhat, but a lot of the variables kind of show it, go down, come up a little bit, level out, and then start to go back down again. So that's kind of what the same trend that's being seen in the country as a whole, is that sort of this plateauing, but then starting to decrease again. In this leading school indicators, we saw, or the school indicators, I should say, almost all of them continued to come down, with the exception of, for us in the town of Fairfield, we saw a slight increase. We had gone down to 19 cases per 100,000, and we bumped up a little bit to 21 cases per 100,000 cases per day over a 2-week period. So we'll keep an eye on that. Fairfield County and the Connecticut numbers on that variable both came down. So we're hopeful that that we'll see that continuing to come down. Looking at some of the trends, what we're seeing with the university students, we saw as they came back in, we saw a fair amount of cases coming in. For about 3 weeks, we were seeing between 30 and 40 cases amongst college students. That has gone down in the last couple of weeks to where we're seeing, more than half that, less than 15 cases for the college students. So it's a good sign that we're not seeing that number go up. And so we'll continue to keep an eye on that. But in general, from a case perspective, things are still going in the right direction, with just a note on that, leveling or a decrease in the rate of decrease that we're seeing on some variables. CDC has put out today some information on guidance on for those who are fully vaccinated, some of the things that they can do. It really isn't much of a relief for many of them. It basically says you can be around your family if you're fully vaccinated, which most of us already are kind of around our family, whether we're vaccinated or not. They even say, well, you can, be around, if you're going to be around people within your, if you're going to associate, if you're fully vaccinated, you can associate with people that are unvaccinated in one household kind of thing. So like vaccinated grandparents can go see their vaccinated children and grandchildren, and without, and they don't have to have masks unless there is somebody who's higher risk. Then they would have to wear masks and stay 6 feet away. And so, not much of a change. We hope that as time goes further along that those types of allowances for those vaccinated, but the CDC was repeatedly had said that the data is coming. They just have to, it's all new. There are lots of studies out there looking at these things, and they're just waiting for the data to support further allowances in that area for fully vaccinated people.
Owen Sands?
Yeah.
I'm sorry, if I could just point out the third bullet point is those that are fully vaccinated can refrain from quarantine and testing following a known exposure if they remain asymptomatic.
Yeah.
So no vacation if you're close contact and vaccinated.
Yeah. So, some of the big things that happened this month, the governor did release or announce large changes to the sector rules. So a lot of them on March 19th, including the elimination, so you have to maintain social distancing and mask use, but a lot of businesses can reopen without capacity limits. So for example, in a restaurant, they still have to maintain the 6 feet or have the plexiglass barriers, but they can go to 100% capacity if they can maintain those types of things. In addition, like theaters are the same thing, libraries, museums, aquariums, gyms, fitness centers, offices, personal services, houses of worship. They can come back in with no capacity limits, just mask use and social distancing. They did make some changes to social gatherings, 25 indoors at private residences, 100 outdoors. At commercial venues, 100 indoors, 200 outdoors. Sports are allowed, tournaments are allowed. And then coming April 2nd, outdoor amusement parks, outdoor event venues at 50% capacity, indoor stadiums at 10%. And then they're still planning going for summer camps, summer festivals, graduations, those types of events, community events like 4th of July fireworks, those types of things. So those are some of the big announcements in terms of what's changed this month. As we were chatting about a little bit prior to the meeting, Jill and I had a chance to meet with via Zoom the principals and headmasters to talk about to respond to questions about their concerns with the schools coming back to more in-person learning. We had that with the administrators, then we had that with the teachers, and then on Thursday we presented or responded to questions from the Board of Ed members. And so with that, I'll wrap up my report and answer any questions you might have.
Thanks, Hans. I just had one quick question about the vaccine clinics that you're doing. Do you have a sense what percentage of the people who you're vaccinating are Fairfield residents versus from outside? I mean, I know that you're open through the VAM system, so that's really open to anyone, but I'm just curious as to see how many of those are actually Fairfield residents.
Yeah, I haven't run that report lately. I mean, very early on, we were 60 to 70% out of town residents. It's because we were one of the only large clinics that, we were doing, 1,000 people a week, without any restrictions. A lot of the towns initially opened up with small closed types of clinics, only vaccinating, select groups. So that trend was reversing. I haven't looked at the numbers lately, and it's you know, the issue, you know, like when you consider the data, you say, okay, well, you know, we've vaccinated a lot of people that live in out of town, but a lot of those people are, you know, people that work in town, that have a medical practice in town, or the staff of that medical practice. And so they are serving Fairfield residents. And that's why they chose to come to our clinic. And the same with the teachers clinic. You know, we see addresses that are from other towns, but, you know, they may be, you know, Fairfield residents that teach in other towns or work at other facilities, or they may be people serving at those facilities in Fairfield that live in other towns. And so, you know, I try not to stress that data, because I think it's hard to really parse that any deeper than they live in town, out of town, and without really knowing where they work, and the time it would take to do that analysis in terms of, you know, looking at how many public school emails, things like that. We just don't have that time at this point. But, you know, again, the number was changing. It was definitely working more in our favor the further we came along, with more Fairfield residents, especially with the seniors. When we started opening up to, you know, 75 and older, 65 and older, it was more and more Fairfield residents, but still a fair amount. So.
All right, thank you. Does anyone else have any questions?
I
Sal?
do. Yeah, just a little bit more of an idea maybe, or comment, but just curious regarding the Johnson & Johnson vaccine that you mentioned. I wonder, do you think, can you hear me okay?
Mhm.
Yes.
I wonder if it might be helpful, you know, kind of, if instead of asking if anyone would decline, maybe looking at it from the glass half full, asking, would there be anyone who would be basically excited about the opportunity to have like a one and done vaccination? You know, I do think the one thing to promote with the Johnson & Johnson, even though it is newer and there might be more apprehension, is that it is the full coverage vaccination from just the one vaccine. And therefore that wait time, or the apprehension that some people have of waiting an entire, you know, 4 weeks or whatever it is, I can't remember, around that for the second vaccine, they don't need to worry about that, right? So
Yeah.
I just imagine there might be some people with a little bit of a twist. Yeah, you see what I'm saying? Just where instead of, oh, would you refuse, or
Yep.
hey, is there anyone who'd like to get this, knowing that you won't have any difficulty scheduling the second vaccine or the need to come back again, and you're fully covered?
Yeah, you know, the issue that we're facing now this week, and why we phrased it that way, is
Mhm.
really about just ensuring we have adequate supply and being able to cancel appointments prior to the clinics. You know, so we need to know that data. We need to know how many people are going to refuse, because if that number is big enough, we have to reach out to some of those people and cancel their appointments. And so that's really, it's about, you know, it's a customer service thing. We're trying to prevent them the inconvenience of coming down and saying, oh, by the way, we ran out and we can't take care of you. But we plan, you know, and we just got this Johnson & Johnson, you know, just literally a few days ago. And so we're just trying to, we already rolled it out for a third-party clinic
Mhm.
on Wednesday, where it was folks that didn't have the tech to come in. We've already used it in some homebound individuals who are excited about it. And what we plan to do when we move forward is to have, depending on how much we get, to potentially have a solely Johnson & Johnson clinic. And that way, everybody that signs up is somebody who wants that.
Mhm.
So that's one of the plans that we have. But it really, you know, they kind of told us we got it last week, and then it's probably going to be 2 weeks before we even see any more
Okay.
shipping. So, you know, we're kind of in this point where we've got a mix of doses coming up this week, and we got to figure out, you know, who, you know, because there was a couple little wrinkles in, you know, announcements by bishops and things like that, that some people are, you know, are more hesitant about it than just a
Yeah,
few
no,
days ago. So
that makes sense. I just was trying to think of a way to, you know,
yeah,
tweak the messaging, as you know, to kind of get the volunteers to go for that for a variety of reasons. The second question, just related to the change in some of the guidelines is I'm just curious for my own, personal knowledge. But as far as the let's say indoor and outdoor events, has there been any determinations on some of the Fairfield locations, right? So things, let's say like Jackie Durrell and Penfield, like places that could theoretically mimic a restaurant type environment and certainly stay within that 100 inside and 200 outside, per mansion, in order to basically give people the option of having some additional event venues as we come into the graduation and obviously weddings, and also just for the financial obviously benefits of that for the town and community. That would be my next question.
Sure, yeah, no, we plan to follow all the sector rules in town. So last year we were a little bit more conservative, but this year we're going to follow all the sector rules. And so I believe, the rec department already has events booked at all those facilities, weddings and other types of events booked at all the facilities, with the understanding that depending on how things go, they may have to cancel them, or they may not be able to do everybody they want to do, depending on what the sector rules may say at the time of the event. But yes, no, those are all already being booked, already making plans, and so those will all most likely be open and operational this year.
Okay, that's great. I was just curious. Thank you so much. That's it for me.
Great. Any other questions? All right, if we don't have any, Ms. Mitchell, if we can get the Assistant Director of Public Health Nursing report.
Sure. Before I go on to the schools, I just want to mention, as far as the clinics are concerned, with schools reopening, our part-time nursing pool and our sub pool of RNs will be decreasing. And so just to let you know, we've drawn on a number of healthcare professionals in the community and beyond who are coming in to volunteer at the clinic. And I guess we've had 3 core individuals who've been here for quite a while, but last week we really picked up quite a few more. A couple of physicians, retired dentists, retired dermatologists in the area, and they've really added a lot to our ability to schedule large clinics safely going forward. So I just wanted to kind of give a shout out to them. The other big news, of course, is the reopening of the schools. Elementary schools reopened today for full in-person, full day with lunch. And the secondary schools had a remote day in preparation for their opening tomorrow. Again, full in-person, full day with lunch. Last week, I reviewed with the nurses, just the various protocols that are going to be happening in the schools regarding lunch and quarantine and the use of barriers and hallway traffic and transportation rules in terms of assigned seating, and just about anything you could think of that central office and really everyone, the teachers, the principals, parents, everyone that has had a stake in the schools reopening, all of the various points that we needed to address to open the schools as safely as we can. So I'm really excited for it, and I can't wait to see what happens over the next few weeks. That's it for me, really. I think that's enough.
Well, Jill, do you want to talk a little bit about some of the, some of the in-school, the contact tracing work relating to
Sure.
quarantines in the classes and some of the things recently, because that's
Yeah.
been working.
Well, actually, just over the weekend, we had examples of both ways. We had a student over the weekend test positive who was in school during his infectious period, so we had to do contact tracing for that. And it turns out, after interviewing the teacher and whatever other staff was available, we determined that only I won't get into the real details, but only a handful of children, either in the classroom or on the bus, needed to quarantine. Today, we had at least two positive cases in the elementary schools, in which after the nurse spoke with the teacher, and I was able to reach one teacher, another one called me just now, and I haven't been able to get back to her yet. And they just felt that they weren't able to safely identify those students who were a close contact or not a close contact of the positive case. So we did end up doing a whole class quarantine in those two schools today. Hopefully going forward in the, as I think I mentioned, probably at the, Sans, I forget if it was the Board of Ed meeting or the meeting with the teachers or the meeting with the executive staff of the school system. But we were talking about having to quarantine at the secondary level, where in the high school, at our private schools, which we used as an example, we had, anywhere from 20 to 40, certainly lower numbers, but 20 to 40 students quarantining at a time. And with block scheduling in the high school, the exposures will not, it will be among 3 or 4 classes, which is the normal period for a student, a high school student, as opposed to the 6, 7, or 8 classes that someone in the private school may expose. So hopefully, we don't know yet. We'll see what those numbers bring when we have, hopefully we won't have too much experience with it, but as the schools open up going forward in the secondary level.
And
No, that's great.
Thankfully, I would just add, thankfully, our overall numbers are as we've indicated in the data, the overall numbers are coming down. So we have some capacity for some of the contact tracers to assist with that work.
And not to put too fine a point on this, but so once our teachers are vaccinated, and at least 2 weeks out from vaccination, they would be exempt from having, they wouldn't be required to quarantine, right? So
That's true.
it would be less of a staffing issue, a staffing burden. If we had to quarantine a whole class, the teacher wouldn't have to go. So
Yeah.
it's a plus.
One thing I did want to mention was the music class. The music class still, we're still working on the guidelines that were put forth in Addendum 7, I believe it was, which for wind instruments and for chorus, they still have to maintain the 12-foot distance. And for string instruments, it's, let me see, it's a 6x9 box that each student has to occupy. That will change. I spoke to the people who were writing, rewriting those rules, particularly after, I guess it's the Secondary School Music Society of America, whoever writes these guidelines. They came out with really relaxed guidelines a couple of weeks ago. And the music teachers had asked me to pursue that with the state DPH. And they said, yes, indeed, we're going to be incorporating some of those new guidelines that they put forth. And I'm really hoping it would be out in a week or so, but I can't guarantee that.
Great, let's hope so.
Yeah.
All right, well,
We
thank
have
you.
had a fair amount of contact tracing with sports activities and related not necessarily school-based groups, but outside groups, private hockey organizations, things like that. We've had to do that, of course, children who live in Fairfield are a part of those teams. And we've had to do a fair amount of contact tracing with that. Nothing that we can say is alarming. There's one situation with a private team in one of the neighboring towns that we're keeping an eye on. But it hasn't affected the Fairfield students all that much. And of course, I don't know if you remember, but with when people are quarantining as a result of a sports team close contact, they can return to school after a successful quarantine after 10 days, but we keep them out for an additional 14 days as per the SEAC rules. And I haven't really heard any problem with that going forward.
I'm sorry, Jill, additional 14 days or a total of 14 days?
Total of 14 days. Thanks for clarifying. It's late.
Okay.
I have a quick question, Jill, and thank you
Sure.
for all the work you're doing on that. And I'll say my 10-year-old was so excited to be back in our first day, right?
Great.
Which is what it felt like today. So there was a really great vibe at McKinley at 3:25 when I was picking up, seeing everybody. So one question I did actually notice in that email today about the all class quarantines. Now, just because it came up today, was that based then on last week? Like what, I was curious if the students were in school today and then everything came out, or it was just like, Friday it came up positive over the weekend, they weren't sent in today, and then the decision was made. I just was a little curious
There were
about that.
two different schools and two different situations.
Okay. Okay, I was, yeah, because I was just surprised if somebody would have gone in today
Nobody,
because,
let me say, no, Sally, I think I know what you're getting at. The parents followed all the rules, and that's what happened. Nobody,
Okay, that's
nobody
good.
sent their child in, pending a test or anything like that. That wasn't the case.
Got it. Okay, because I've heard, for the most part, people have been very good about that, right? Like
Okay,
that's,
I think they have been. I think I
Yeah.
really commend the parents in doing that.
yeah, the consensus that I've gotten. So that's why I was just curious since it came out on a Monday, you know what I mean? So that's great that went, that's going smoothly. Okay, thank you so much.
Sure.
Any other questions for Jill? All right, if we have none, Sans, any communications?
I have none.
Great. Any old business anyone like to bring up?
I have none.
Great. Any new business?
Nothing on the agenda.
All right.
I'll
Fantastic.
just say for the
Yes.
record, if you hear me, I know I sent an email, but I just will on the meeting say, I apologize that I got so upset last meeting, and, points taken, and I appreciate those of you who I spoke with, and it was just an emotional time period, and a lot of things kind of came together, and a lot of emotions, and people have their breaking points, which we've all experienced the last month or so. So I just want to say that kind of for the record to all of you, and I appreciate the work you're doing. So
Understood.
All right. Well, thank you. I don't think an apology is in order, but thank you
Not at all.
for the sentiment.
Definitely not.
All right. Fantastic. Well, if that's the case, can I get a motion to adjourn this meeting?
I motion to adjourn.
All
Mr.
right. Thank
Francis.
you. Meeting.
Second.
Thank you. Meeting adjourned at 8:11 p.m. Thank you, everyone.
Thank you
Thank you.
all.
Thanks, everyone.
Thank you guys for
Thank you.
everything.
Thank you all very much.
Thanks.
Bye. Good night.
Bye-bye.